Okay, hello again, everybody. Today is December 21st, 2022. That means today is the winter solstice, meaning it is the shortest day of the year, at least in the northern hemisphere. And I thought that would be a good opportunity to try to set the record straight on what we call vitamin D, that's sometimes called the sunshine vitamin. So I hope everybody is having a wonderful holiday, whatever holiday you celebrate, that's the word, this time of the year, and that you're managing what's a pretty cold and darkest time of the year. It's a good time to go inward and take stock and find out what the world is all about and what you're all about. That's sort of the inward meaning of what's happening right now. So we're all going inward. But but again, I thought we could take a look at the what we can actually find out about vitamin D. So let's get to that. And before I get to that, I want to acknowledge that I'm certainly no vitamin D metabolism expert. So I did something that I think was smart of me, which is I consulted two friends that I've actually highlighted on podcasts in the past, my two Italian friends, Alessio and Angelo. I don't remember their last names, but Angelo in particular has taken a very deep dive into everything there is to know about vitamin D, and in fact has written an entire book about it, which is, I think, 400 pages with hundreds and hundreds of studies about vitamin D. Unfortunately, it's not translated into English yet. I'm not sure if that's going to happen. And I thought about having him just so I could sort of interview him, but frankly, I thought it might be easier. There's a little bit of a Italian to English translation issue. So I thought it might be easier for me to try to translate essentially the essence of his work. And so Alessio was very kind to send me an entire write-up of the studies that they're basing their conclusions on. And then they commented on some of these studies. So that's essentially what I'm going to be showing you. And I want to point out also, as I've done a number of times, that if I get anything wrong in this presentation, that's undoubtedly my problem and not Alessio and Angelo's problem, because they were very clear, and there was some of it that I was struggling to understand the physiology or the biochemistry. So if, as I say, if I got anything wrong, that's my translation of their work or their conclusions. But hopefully I didn't get so much wrong so that we will have a fairly faithful reproduction of what they're saying. The other reason I thought to do this was I was sent a study that set me off a little bit. So here's the study. And this was published on Mercola's website. And you can imagine that this didn't sit well with me so much because this title was a new study on vitamin D combating COVID. And I have learned that even mentioning the word COVID is probably a mistake. Not probably, it is a mistake. This was published, as you can see, in December of 2022, so it's fairly recent. What I mean by that is part of the, what you call it, the mind misinformation campaign is the actual using this word COVID, which, as I've said, the only actual definition that I know of that's I think is valid is essentially looking at the actual word and saying see, as in see with your eyes, see the ovid, and the ovid is obviously a sheep. So we're talking about see the sheep. But unfortunately, people use it to refer to a disease. And that is the first thing that caught my eye on. So is there a study that shows that vitamin D combats COVID? Let me get out of this for a minute and just talk about that. So the first thing I would say then is, so obviously we need to get a definition of COVID, and I happened to run across this. This was, I guess, from the New York Times a few days ago. It's very interesting. This, I think, was sanctioned by the CDC, although I'm not sure about that, who actually came up with this chart. And it had an interesting title. Do you have COVID, flu, or respiratory syncytial virus? So those are your choices. You can see you can vote rarely, sometimes, or often. Now, as I've said over and over again, if you're saying that something is a disease, and in particular saying that it's a new disease, there is a very specific process that you have to go through. Number one, you have to identify symptoms that are new or unique or absolutely characterize that disease you're talking about. If there is no symptoms that are characteristic, so-called pathognomonic of that disease, it's hard to make the case that there is a new disease. It's hard to make the case that there is any disease if the disease shares all of its characteristics with, in this case, 3 other otherwise uncharacterized diseases too, all of which are misinterpreted from reactions of your body detoxifying or cleansing to a so-called acute infection. But let's skip that for a minute. So what are the symptoms that characterize COVID? And this will become important in the vitamin D discussion. So we see there's cough, that's shared by all 3. Difficulty breathing, which is shared by all 3. COVID has a little bit more, they say. Fatigue, which is the same as the flu. Fever, which is a little bit less than the flu and the same as RSV. Headaches, which is the same as the flu, a little bit more than cold or RSV. Muscle pain or body aches, a little bit less. New smell or new loss of taste or smell, a little bit more, but they all 4 share it. Stuffy or runny nose, a little bit less than colds or RSV. Sneezing, sore throat, same as a cold. Vomiting or diarrhea, same as the flu. Wheezing, less than RSV. In other words, there is no symptom that could make anybody say that they have something called COVID-19. All of the symptoms, according to the CDC, are shared by other common phenomena. Now, the next thing is then they say, well, you have to have a test that confirms the diagnosis. And we've all been through that a million times. We know there is no test that makes the diagnosis of COVID, for the simple reason that in order to have a valid test, you have to have a gold standard that which you can compare the test to that you're doing. In other words, in order to do a test, which is a surrogate marker, meaning it's not a direct test of whatever you're looking for, you have to have something that is indisputably characteristic of that situation. And then you do a test, and then you do it on people who you know have that illness or that condition. And then if they're negative, you end up with a false negative rate. And if they're positive in a condition where they can't possibly have that situation or disease, you end up with a false positive rate. And that's how you end up with a clinically useful validated test. The example that I've used, which is not a disease, but a condition, is pregnancy. We can all know that somebody is or isn't pregnant. Then you can do a blood test on 100 women who are pregnant. If one is negative and the other 99 are positive, you have a 1% false negative rate. If you do it on 100 men or 100 prepubescent girls or women over 60, and none of whom possibly could be pregnant, and you get one that's positive, you know you have a 1% false positive rate. And that is the only way you can end up with a valid test. Since that is not the case with COVID, because there's no gold standard, so there's nothing to compare it to, you can't possibly have a validated test, which it seems that everybody agrees with, even the CDC. So with that background, that there is no diagnosis of COVID, there is no test that validates it. By the way, I happened to find this, which is a little bit of an aside, but this is now how we signal that there's a new variant. There's white smoke emanates from a Wuhan lab chimney, signaling a new variant has been named. So that's the science of new variants. So then we go back to this paper by Mercola saying that the new study on vitamin D combating COVID. So here's what he says, the story at a glance. Researchers at Johns Hopkins and the University of Chicago, et cetera, conducted a large scale, the association between vitamin D and COVID infection and mortality. Those who took vitamin D2 had a 28% lower risk of COVID infection. Those who take D3 had a 20% lower risk. Death from COVID was also lower among those taking vitamin D, 33% lower from those taking vitamin D3 and 25% lower amongst those taking D2. Then they speculate that if the entire population had supplemented with D3, would have prevented 4 million COVID cases and 116,000 deaths. And then he says, which I agree with, and we'll get into this, I recommend getting vitamin D from sun exposure if possible. But it should say then, as we'll find out, and if that's not possible, don't make the mistake of taking vitamin D supplements ever. So unfortunately, that bit was left out. So the question then is, how did they determine these cases and vitamin D? The first thing I want to point out is, I'm not sure if I can find this. The way they found out whether people were taking vitamin D is basically they asked them in these studies, you know, we gave you vitamin D, did you take it? So it was a sort of retrospective analysis. So there was a study involved a large population of veterans, 220,000 people. And the way they got that information was they asked them whether they took it before the pandemic so-called started. But the real thing I wanted to mention is the research confirms that it was low vitamin D raises the risk of infection. So how did they determine that these people had a COVID-19 infection? So you can see here, one study had a 77% increased risk of COVID infection with vitamin D deficiency. People with low vitamin D had a 59% increased risk of severe COVID-19 infection, etc. So this is all about saying that vitamin D correlates with COVID infection. So the obvious question is, how did they determine, since there is no symptom that you can use to determine whether somebody has COVID infection, and there is no lab test, how did they figure out that these people actually had a COVID infection? So here we go. This was a little bit of an aside, and why this is so important. This was a recent piece by Fauci in the New England Journal saying it ain't over till it's over, but it's never going to be over. And basically, he went through how when he started his infectious disease training, they told him that there was no infectious disease and we don't need infectious disease specialists. And as he said, then came AIDS. And now we need infectious disease people more than ever, because the era of infectious disease will never end, according to the sage advice and counsel of Dr. Anthony Fauci. So unless we change the narrative, he's probably right. It's never going to be over. That's why we keep working on this. So let me give another aside. I know I'm jumping around here. So what is vitamin D? But let's get into, let me not jump around. So this was one of the main studies that was referenced in the Mercola article, called The Association Between Vitamin D Supplementation and COVID-19 Infection and Mortality. This is the main journal article that all those conclusions were based on. So you can see it's vitamin D deficiency is associated with increased risk of infection. It's unknown if the treatment can reduce the associated risk, and so that's what they wanted to find out. And they wanted to see if, in fact, this was the case. So we want to know, of course, how they did this. So here's what they did. We conducted a retrospective cohort study to determine the association between D3 and D2 and COVID infection and mortality. We estimated the association of cohort of VA patients who received supplementation, either any of these for a period before the pandemic or during, and untreated control patients. This was based on an estimation of matching treated and control patients one-on-one in their propensity for supplementation separately for D3 and D2. So essentially they asked them, do you remember taking D3 or D2? And that's hardly, I would say, scientific, but let's not worry about that for now. The main thing I wanted to bring up was in this outcome. So how did they determine that these people had a COVID infection? And here's, they say in the outcome, the primary outcome was a laboratory confirmed COVID-19 infection as measured by any VA medical record or Medicare claim containing a diagnosis for ICD-10 code, this one. In other words, they looked in the medical records or the VA records or the Medicare claims, and if they saw that they put the diagnosis for COVID-19, that means they had a case of COVID-19, and that was confirmed by a PCR test. So that is what they're calling a COVID-19 infection. The interesting thing about this is we all know that neither of those actually diagnose any such thing. There has been so much talked about and written about how people are putting diagnoses on laboratory or medical records, Medicare claims to get more money or sort of to game the system. So there is no science behind saying that these people have any kind of diagnosis that could be called COVID-19. We know there is no lab test that confirms it. We know there are no symptoms. We know that just doing a study based on the medical record diagnosis is the epitome of unscientific analysis. So that should end any speculation that they in fact showed any relationship between vitamin D and any so-called infection. So that's the first thing. Now let's get into, here is essentially what we, here's a bit of the biochemistry or physiology of vitamin D. So here you can see the pathways that we're told as the production of vitamin D from 7-dehydrocholesterol in the epidermis. That's this one. And then the sunlight breaks this B ring of the cholesterol structure, and that forms pre-D3. And this undergoes a thermal induced rearrangement to form this one, which is called D3. The continued irradiation, in other words, sunlight of pre-D3, leads to the reversible formation of lumisterol 3, which is this one, and tachysterol 3, which can revert back to pre-D3 this way in the dark. The main reason I want to show this slide is this makes it perfectly clear that we're not actually dealing with a vitamin, which used to be called a vital substance that has an amine in it, which is a nitrogen ring. So we're not dealing with that. And then the newer definition of vitamin is something like a cofactor that is something that we're not able to produce on our own, that we have to get from our diet. So there is no way that this substance fits that definition of a vitamin. In fact, it is a steroid hormone. The hormones like testosterone, estrogen, progesterone, prednisone in particular are called steroid hormones because they're all breakdown products, or metabolites, a better word, of cholesterol, as is vitamin D. So you start with cholesterol, you metabolize it into D3, which is a pre-hormone. In other words, it's an inactive hormone. In other words, it doesn't do anything itself. It's just it's an intermediary metabolite. It's on the pathway, which I'll show in a minute, to forming the active form. But this is a steroid hormone. Make no mistake about it. So if you are taking D3, you are taking a steroid hormone. And the best way to think of this is a weak version of prednisone. And I think this will explain everything about why you see people have a reduction in their symptoms of detoxification or inflammation when you give people large doses of a steroid hormone. The same thing would happen if you gave them large doses of prednisone, or in fact, any dose of prednisone. These steroid hormones, like D3 or prednisone, which it's a very close cousin of, work in an anti-inflammatory mechanism to reduce symptoms of detoxification while they make the overall situation worse. In other words, you're trying to get your splinter or the debris out of your lungs by using inflammatory detoxification pathways, and the prednisone or the D3 stop that. You think you're temporarily better, which you are, have less symptoms, but obviously the debris and the toxicity build up, and you will pay for that in the long run. So then we go on with the metabolism of vitamin D. And we see this, which is the D3, the metabolism of vitamin D. The liver converts the D3 to 25, or vitamin D to 25 OHD. The kidneys convert the 25 OHD to 125 OH2D and 24 25 OH2Ds. Other tissues contain these enzymes, but the liver is the main source for the 25 hydroxylation, and the kidney is the main source for the 1 alpha hydroxylation. And this 125 OH2D is the active hormone and is exerted primarily at the kidney level, where calcium, phosphorus, parathyroid hormone, and other substances regulate the levels of the 125 OH2D produced. In other words, this is the one that we want, which is part of this feedback system involving calcium, phosphorus, parathyroid hormones, etc. D3, this guy that is used in most supplements, is an intermediary metabolite which has to be processed in the kidneys in order to form the active hormone. And again, if you have the buildup of this, it acts as a anti-inflammatory steroid, again, similar to prednisone. So let's now go through Angelo's paper and see what he was able to find with the actual research on what do we know about vitamin D. So is it the panacea or not? So this is the collected evidence that shows that the claims about the alleged benefits from vitamin D supplementation are based on scant associations coming from epidemiological studies. It's similar to the germ theory. They just assume that finding the germs on the crime scenes makes them guilty of the crimes. So here is a first article, and I think just for the interest of time, I will show the article. So this is a study. So now we're going through what does the actual research. Here's does vitamin D supplementation and prevention of cardiovascular disease and cancer in the Finnish vitamin D trial, randomized controlled trial. And what did they actually find? And I'll just go through the conclusion. The vitamin D3 supplementation did not lower the incidence of major cardiovascular events or invasive cancer among older adults, possibly due, they say, to sufficient vitamin D in most participants at baseline, or maybe because it doesn't work. Sorry, I got out of that. So here's their Angelo's comment. There was 3 groups: placebo, 1,600, 3,200 IUs per day. After 5 years on responses to cardiovascular disease, the world's leading cause of death, and today even worse, 0. Despite the consistent increase in 25 OHD3 levels, as advocated by the supplement and food gurus, despite deficiency being associated with a higher prevalence of events and mortality. So they had essentially no benefit with either cardiovascular events, even though they got the levels up to where the vitamin D people say they should be. Now, here's another important study on what is the risk of the relationship between vitamin D and the risk of falling. So we see this a lot. The reason you should take vitamin D is so you don't get a hip fracture or you don't fall. And again, there's a link to a study, and we will post this paper so anybody can go through these at their leisure. You can go through all the studies in great detail. So vitamin D supplementation and the risk of falling, randomized placebo-controlled D health trial. Conclusion: monthly high-dose vitamin D supplement did not reduce the risk of falling a possible increased risk of falling with vitamin D supplementation in people with normal body mass index warrants further investigation. In other words, the only conclusion they could come to was, unlike what we've been told, vitamin D supplementation does not reduce the risk of falling, and it may increase it if you're a person of normal weight. And I keep getting out of this. So Alessio's comment on this was, the starting hypothesis for vitamin D studies is always the same. Falls in the elderly are associated with a deficiency of vitamin D. What happens then if we restore levels with pills, and more importantly, do it for many years? In this study, a monthly megadose of vitamin D to give to some patients, and others were a placebo. The dose was 60,000 IUs a month. That's not an unusual dose. After more than 4 years of this hormone therapy, meaning vitamin D, which is a hormone, not a vitamin, the vitamin D levels, the OH3, were higher in the treated group than in the controls. And they were at the levels that the prescribing physicians now would say normal. So it worked, quotes. They gave them the vitamin D. They used the high levels that people are advocating. They got the levels up on the blood test. So what happened to the falls? It said the results were very disappointing. Patients with a body mass index over 25, in other words, obese or overweight, had no benefit, but the patients with the normal range, i.e. fit people, manifested a, quote, alarming increased risk with vitamin D supplementation. How sad that all, I mean all, of the randomized controlled long-range trials featuring vitamin D are yielding very disappointing results, sometimes worsening. Because the diagnosis of deficiency is wrong, and if you want to find out why. In other words, dosing with the levels that the vitamin D supplement people say is really what you need to do to get adequate levels. The only thing they could say is it had no effect on you if you were obese, and if you were not obese, it made your risk of falling worse. Now, here was one of the most interesting studies that they presented, the relationship between vitamin D and celiac disease. And this may also apply to other inflammatory autoimmune diseases. And here is the article. Again, we will post this so you can look at this in your leisure. And this was a study of, they looked at the prevalence of celiac disease, which has increased in developed countries in recent decades, and we don't exactly know why. So they think maybe there's environmental risk factors that they wonder if elevated levels were a missing risk factor for celiac disease, and they were wondering whether vitamin D exposure is the missing environmental factor. So they found that the elevated levels of 125-OHD are common in celiac, especially in newly diagnosed, which of course doesn't mean it causes it. And they found 9 distinct conditions that increase levels of this 125-OH2D are associated with celiac or have indications of such an association in the literature. In other words, they're finding lots of different associated conditions, things like food allergies and so-called IBS, et cetera, that are also have elevated levels, and they're wondering if that's connected. Third, a retrospective study showed that sustained oral vitamin D supplementation in infancy is associated with increased celiac disease risk, and other studies on comorbid conditions support this association. In other words, it seems like one of the ways to get celiac disease is to give your infant oral vitamin D. And interestingly, the oral vitamin D supplementation has coincided historically, which doesn't prove that it's the cause, with the rise in celiac disease. And then they give some biochemical explanations of upregulating inflammatory markers. They talk about the timing of the celiac disease epidemic in Sweden corresponded with the increase in vitamin D oral exposure that may have increased the risk. So, what does Angelo have to say about this? This is very interesting. And again, this is a brief summary, and you can, if you can read Italian, you can go here, but see what he says. Chronic inflammatory patient, reserve D, low, dumbed down doctor. Well, let's top up at a high dose to restore the vitamin D 25 OHD level to quote normal. There's a chronically ill inflammatory patient. The reserve vitamin D is low, but the active form, which they never measure, is high. Result, you are not vitamin D deficient, but trivially inflamed. Therefore, this doctor made the wrong diagnosis and gave the wrong treatment. In other words, well, here I'll get into what he says. The patient is better in the short to medium term due to the immunosuppressive, I think a better word there is anti-inflammatory effect of this prednisone-like hormone. And the disease goes on undisturbed to recur devastatingly later in life. Then he goes on to give evidence that the vitamin D actually destroys the microbiome, and particularly in children. And yet pediatricians in 99% of cases prescribe the hormone even in pregnancy, instead of recommending sun exposure and a diet rich in protein and animal fat. In other words, to put this into plainer English maybe, this vitamin D, like prednisone, has an anti-inflammatory effect. That is temporary. It also interferes with the microbiome, the bacteria that are meant to live in your gut. And so the effect of that is just like giving somebody prednisone on a long-term basis. You negatively affect the microbiome. You end up giving essentially a toxic hormone to the gut, which reduces the inflammation temporarily, probably thins the lining of the gut, and you end up with a disturbed gut environment with thin, porous membranes. And then if this keeps going on because you keep taking this toxic hormone, you will end up with somewhere between leaky gut all the way up to celiac disease, which is exactly what the epidemiology shows, that the more we give children and young people vitamin D3 supplements, the rise in food allergies, irritable bowel, Crohn's disease, ulcerative colitis, even celiac disease happens because you have given something that has negatively affected the gut. And all this in the name of a so-called healthy vitamin. To summarize this section, evidence from animal studies suggests that high-dose vitamin C supplementation has significant gastrointestinal effects that are characteristic of celiac disease. Evidence in human studies is mixed, but one study found a statistically significant association between vitamin D supplementation for greater than 3 months and infancy and celiac disease. Another study found an association between a measure of any prenatal vitamin D supplementation and celiac disease autoimmunity in the child. In addition, the literature suggests that significant vitamin D supplementation in infancy is associated with 2 conditions that are often comorbid with celiac, which is supportive of the hypothesis that vitamin D supplementation in infancy is associated with celiac disease. Again, if this connection is validated, and it should be, it has profound practical implications. First, the practice of prescribing oral vitamin D to celiac patients based on the low levels of 25-OHD that are often observed in newly diagnosed should be reevaluated. In other words, this low level is a effect of the chronic inflammation, as your body will try to convert the 25-OHD into the active form as much as it can, because the active form has beneficial effects. And so you see what seems to be a deficiency of 25-OHD, which unfortunately is the only thing measured. And so they end up, because of that, giving you this toxic hormone to supposedly correct your deficiency. So then decreasing exposure to large oral doses of vitamin D that are frequently consumed in developed countries may decrease the risk of celiac disease. So that explains a lot about what we're seeing today with the gut problems and food allergies and all the rest of it. Here's another article on the toxicity of vitamin D, which I can't link right now, but you could find it if you want. And here is the comments. So the processing of vitamin D produced in the skin has evolved in a way that protects against potential toxicity. In contrast, the maintenance of adequate status by continuous oral supply of vitamin D has only been a strategy for about 100 years. Thus, no protective adaptation against any vitamin D toxicity by this route, unlike the physiological processing of vitamin A that had time to evolve. Animal studies demonstrate that long-term maintenance of vitamin D status by supplying oral vitamin D may be associated with vascular pathology like heart disease. It would therefore be wise to develop population strategies to avoid this potential vitamin D toxicity and utilize the physiology of vitamin D formation in the skin. One such strategy could be the controlled exposure of the skin to UV light in the vitamin D producing wavelength of 290 to 320 nanometers. So they're saying that essentially oral vitamin D3 supplementation is associated, not proven to cause, but certainly associated with many problems, none of which are seen if we get our vitamin D through the normal way, which is exposure of our skin to UV light in this wavelength. And the second way to get it is through the consumption of the fat, because vitamin D is a fat-soluble product, the fat of animals that have themselves been exposed to UV light throughout essentially all of their life. Okay. They go on to say about how vitamin D supplementation seems to have an adverse effect on the retention of heavy metals. Here is something on vitamin D and sun exposure and mortality, showing that sun exposure definitely is associated with decreased all-cause mortality, something that has never been found for D3 supplements. And I could go on with some papers that that claimed that supplementation with vitamin D increased muscle strength and fitness, but they had to retract the paper because of the shoddy science. And here's the announcement of the retreat. And you can follow this up on your own. So I could go on. Here's maybe the final one. The randomized control of the effect of vitamin D on mortality. This was in the Lancet, February 1st, 2022. Does not reduce vitamin D3 monthly supplementation to unscreened older people, does not reduce all-cause mortality. So they say, I wouldn't bother to do this because we don't know that it's safe or effective. And again, there's a whole paper here, vitamin D restoration with pills. Evidence from human studies. Conclusion, supplementation of vitamin D replete individuals does not provide demonstrable health benefits. So it's very difficult to make a case that there is anything good coming out of vitamin D supplementation. In conclusion, supplementation of vitamin D does not generate overall health benefits. Interestingly, to go back to what is this connection between so-called infections and vitamin D? And here Angelo makes the comment, since the viral replication is completely bogus, there is of course no virus. What they're seeing is less cellular debris in a cell culture because of less cell breakdown. So another metabolite of UVB exposure, lumisterol, exerts prevention of cell breakdown, most probably contributing to tissue health. And so there we go back to our slide we showed earlier with the physiology and the metabolism of vitamin D, that prolonged sun exposure and only prolonged sun exposure will push the pathway of the vitamin D production into this form, which seems to prevent cell breakdown, which is what we erroneously call a viral infection. And so it will have a beneficial effect on all kind of inflammatory diseases, all kind of what are misnamed autoimmune disease, allergies, celiac disease, etc. But this is only produced under the influence of sunlight and UVB exposure, not through taking vitamin D supplements. In fact, there is some evidence that the more vitamin D supplement, D3 supplements you take, the less of this protective tissue breakdown substance you actually make in your body. Here we go into the relationship between elevated calcium and vitamin D in cancer, and how that's a dysregulation of vitamin D, probably from decreased sun exposure. And again, they see a vitamin D deficiency in these situations of people with malignant cancer, and that's because of the chronic disease and chronic inflammation that is the hallmark of this cancer process. You're essentially poisoned. Your body tries to get rid of the poison by creating inflammation. That tells your body to convert the D3 into the active hormone. The people who don't understand this come along and say, oh my God, you're vitamin D3 deficient. They give you more of this hormone. It has a beneficial temporary effect of reducing the inflammation. But since the inflammation is your therapy, you end up getting worse, which is why they can find no benefit for people with invasive cancer from taking vitamin D supplements. As he says, when you have low storage D, it is simply a marker that you are inflamed. They simply top the absurd amounts with a powerful immunosuppressive, or again, I would say anti-inflammatory effect that makes people cry for a miracle, but in reality, they are just doing even more damage. But here, the sun prevents cancer, the pill does not. They even go on to say that reports that people who get sun exposure, but unfortunately take vitamin D3 as a supplement, this protective effect is prevented, meaning somehow that you can't follow the normal pathways. Here's some other stuff on vitamin D supplementation does not provide demonstrable health benefits. We've already seen that study. And I could go on, inflammation, so-called COVID, why testing it is nonsense. Strength training, and all-cause mortality. So we get out of this and finish up here. One more thing just to show. One of the issues here is if you look at this chart, just this first one. Here it's the UVB wavelengths that stimulate the production of vitamin D. And you can see the movement or the exposure of UVB throughout the day. And so it has to be apparently when the sun is at its highest, which is difficult to have enough sun exposure, particularly in the winter. So what should people do? And just to summarize, the take-home message here is vitamin D is a steroid hormone. It's made like all the other steroid hormones. In this case, the natural way is through people who eat, who are essentially replete in cholesterol, meaning you eat enough of it, you don't take cholesterol-lowering drugs, you're not trying to reduce your cholesterol by red yeast rice or any other nonsense like that. So you have enough cholesterol, the cholesterol is in your skin, it interacts with the UVB light, and that triggers the formation of the health-giving, life-supporting metabolites of vitamin D, of which there are probably many, some of which we probably don't even know. And that is the only way that humans are meant to restore their supplies of this very important hormone, with the exception of in the winter, eating the fat of animals who have also been able to put on fat and spend their lives in the sun. Now, I don't really want to get into sort of promoting products, because then people will say, well, the only reason I did this was to promote a product. But the conclusion of all this, and again, I would encourage everybody to read Angelo's paper, and again, we will put it in the links, and follow the studies, look at it for yourselves. There are essentially no benefits and a lot of toxicity, and a lot of the illnesses that we're seemingly increasing may be actually somewhat related to the increase in vitamin D3 supplementation. So it should be obvious that I don't see any reason for any person to take any vitamin D3 in any food, supplement, pill, decoction, liquid, anything. And I actually went through all the things that we carry on our stores. And as far as I know, we don't carry anything with vitamin D3 in it, because I don't think anybody should be taking that form. The only ways to do this, the only healthful ways, are sun exposure, particularly with much of your exposed skin, particularly around the midday time, or eating the fat of animals that themselves have spent their life in the sun. I will say, though, that for those of us who live in northern climates in the winter, which includes myself, I use the light box, here it is, that Angelo and Alessio came up with. And again, I would encourage people to take a look at their research. You can go to our website, and I think this is called the Mars lamp. It's, again, let me show it to you in case you didn't see it. It's basically the light box, and I spend between 2.5 to 5 minutes on both my front and back pretty much every day and it's specifically designed to simulate the sun exposure with the proper UVB wavelengths. And again, I would encourage everybody to really check this out and look at it. You can find the link to the product on the website, and then there's links to videos that Angelo and Alessio made about this. And that is the third way that we now have to restore the levels of this important substance in our body without exposing yourself to the toxic effects of vitamin D3 supplement, which, besides being toxic, simply don't work. So hopefully that clarifies on this solstice, the day of the least light, just how important sunlight is. It may be essentially one of the most, if not the most, crucial nutrient we have is sunlight, water, love, song, good cheer, great food, and the surrounding by loved ones. So don't leave any of those out. Go out in the sun, eat the fat of animals that have been pastured, and check out the sun lamp that Angelo and Alessio have come up with to allow people to get the benefit of healthy vitamin D metabolism, even in northern climates in the winter. Okay, everybody, take care. Again, happy holidays, warm summer solstice, and there won't be a webinar on Friday, and I will see you all next Wednesday.